viewers, you're most welcome to Coherent TV. This is the Big Topic Show with your host Emanuela, and today we are live in Amuru District, and we are hosting one of the healthcare providers in Amuru District. He's going to share with us a lot, and always on Big Topic Show, we get to share a lot of complex topics, and today we're going to talk about abortion, comprehensive abortion in large. And it's a big and complex topic. But before we dive into our topic of today, let's get to know who our guest is, then we can get to move forward. You're most welcome, sir.
Well, thank you so much, Emanuela, once again to Amuru, specifically to Bay for Uganda, as one of the service providers within the district. You're most welcome.
Thank you so much. Can you kindly let our viewers know what your names are?
Well, I'm called Gabriel Ongom, public health specialist at the same time the service provider.
Okay, thank you so much. And just like he has introduced himself to us, now we are diving deep into our topic of today. And I told you we're going to talk about comprehensive abortion care, and it's really a complex topic for today. And so would love to know from you, our guest, being someone who has ever worked with Coherent before, and being someone who has ever worked in the line of abortion, what has been your experience like? Given the fact that abortion is a complex thing, and when someone just mentions abortion, it actually scares us. So what has been your experience like working around the area of abortion at large?
Well, thank you, Manuela. I think when someone talk about abortion, really it's a broad topic. But however much we also try as much as possible to try to narrow it down and try to explain to our beneficiary. But well, abortion is really broad, and with cut across, we have got a number of them, like therapeutic abortion, we have mesh abortion, we have induced, we have quite a number of them. But specifically, people, most cases, focus on induced, but they are really in need, and the service is really very necessary for this case, and we find it's very important service that we always offer to our patients, and it's a life-saving service, and it cannot be left out without talking about.
Okay, well, you're talking about abortion being life-saving, and then on the other hand, someone looks at abortion being, a crime. So, would you love to shed a picture of what abortion is like when you talk about life-saving? What do you envision, or what cuts up? Okay, what is it that it's life-saving?
Well, generally, abortion is a very important service that we do also offer. It's a life saving because once abortion is not done, especially for cases that are really like abortion, in case like someone could have had a miscarriage, and really to avoid the complication that would come afterward, which is in case that maybe they have not handled. The complication can lead to loss of life, and so generally abortion is really done to reduce on the mortality and the morbidity rates, eventually due to complication that could arise after the abortion could have occurred, to really, and it is really very vital, very important service really.
Okay, well, I'm actually getting to know that abortion is a life-saving service. I didn't really know. What I only knew was that abortion is only when someone terminates a pregnancy deliberately. So today I've got to know that abortion is a life-saving service, and so yes. Well, moving forward, I know that there could be some challenges that you face in the line of provision of these services. Could you get to enlighten us with some of the challenges that you've faced in provision of the abortion care services?
Well, I mean, is the offering of the service. Well, of course, we still have quite a number of challenges, but that does not scare us. But about all, there's still stigmatization, which is still there in the community. In most cases, people look at someone who have undergone abortion as a criminal, but in actual sense, someone could have saved the life, and it really, it really is still there. Then also I mean, there's also the service reason of the abortion. The religious and also the cultural bit of it still hinders people to access the service, and yet it's very necessary. So we always try to engage at the beginning to properly engage and also do psychosocial support, emotional support after the service has been done, so that someone doesn't go back with the same attitude. In fact, someone who have got service will go and tell good news that really the service is very necessary. I'm very much pleased that some of the people who always talk against the service reason of abortion, like pastors, we always get them here. We always get them here, and really, after getting the service, they really appreciate, because you find a mother coming with a serious PB bleeding, and you really need to. Some of these other things really need transformation. Actually, need sensitization. People really get to know, because there are times we need to value the life. Also, at the same time, we need to value our patients' care. But above all, we really do a lot of supportive care before doing the service. Yeah.
Well, besides the religious and the cultural, the stigma, and some of those challenges, what else do you face? Are there some other challenges that you face besides those that you've mentioned?
Well, of course, the some of the challenges. Of course, sometimes the abortion come with a lot of complications, and we really need to be well equipped. And sometimes you find a mother of overbleeded, and you need to really refer and make a blood transfusion and all that. So there's one or two other challenges, but of course we are always equipped, and where there's need, we make a necessary referral where necessary.
Okay, well, thank you so much, Mr. Gabriel, for having given us those clues, your experience. We are going out for a short break, and we're going to get back in the next episode of the show. Please don't go away. If you have just joined us, kindly follow us on all our social handles on Facebook, Twitter, on our YouTube channel, and get to know what our topic of today is. Thank you so much. Welcome back from that short break. We are still continuing with our segment of the Big Topic Show with me, your host, Emanuela. And well, before we actually went in for the short break, we were talking about the challenges that you face as a healthcare provider in provision of comprehensive abortion care services. Then I would really love to know from you, how have you been able to mitigate these challenges, or how have you been able to maneuver through amidst all these challenges?
Well, I previously talk about those are some of the few that we always come across, select from our community within. But we have been able to create a conducive environment that will always call for the people to always come. But the major focus will always be to transform the attitude, to transform the negativity that people always have about abortion, vis-a-vis the benefit that's always associated. We always give because we always try it, and because abortion is a reproductive health care service. So we feel when people get aware about the benefits, and leaving aside the negativity only, I think people always try to get the benefit, and look for the services, because it's really very relevant and very necessary that people always seek for the services. And beside, there are quite also some other few religious challenges, because when you move around some of the religions, like the Anglicans, and also sometimes the Moroccoles, they are always biased about abortion, but they are really, we always try as much as possible to come and to harmony, and we try to sensitize them. However much sometimes we try, but also the bit of it still remain, but the people always come and look for the services. Yeah, sir.
Well, I think I actually heard you talk about stigma. You know, now when we have stigma, don't you think the people that really need these services will be able to come and access the services? And if not, what happens to them?
Well, of course, people always, there are times when you are not part of the problem, you don't consider. But basically, people who have gone through the similar problem, they are the one to really manifest and tell the truth that really the service is very necessary. However, the buyer's mind still remain that someone has gone through abortion and all that, but still people always talk about the bad part, but the advantage, the benefits really is left out. But we always also play a role and try to make a little bit confidential, because the privacy is also very key in order to avoid this circumstance of stigmatization. Yes.
Well, I understand that sometimes you may even find that what have you been able to do? Okay, like how have you been able to maneuver? Now I know sometimes you may be having your personal beliefs and the professionalism. How have you been able to strike a balance between your personal beliefs and professionalism when it comes into saving lives?
Well, of course, we have cases that really sometimes as a professional person you also feel like yes, this is necessary, but this also is not necessary. Of course, you need to be able to differentiate the need for the service, not leaving aside the inevitable and other abortion, but there are other cases that will always come. There are stages that really you need to do thorough counseling and emotional support to the individual before making a consent decision. Because some of these other things people already hurry and say, "This I want to terminate this pregnancy," all of this. But the first thing which will always come to your mind is, this really necessary or this is not necessary? And we also provide you professional knowledge and to the person, and also try to explain thoroughly before someone come out and make an intense decision, so that you can be able to offer the services. But about all, you need to engage both of the partners where there's need, because really there are cases, for example, like therapeutic abortion, where you need to decide, because the life-saving situation where you need to save one of the life of the maybe the life of the mother, so you need to come out with a consent decision and decide, and that's really very necessary.
Well, I've really got to know today that abortion is a life-saving service that needs to be provided to our mothers out there. And now, coming in back to you, what do you think can be done to help you out as a healthcare service provider to ensure that your work is made in easy?
Well, one of the first most important thing is proper documentation. Really, this service, because there are regulation, there are laws that really regulate. It is not really abortion is bad, but is restricted to some scenarios, some cases. So the law really also limit us from other provision. But however, once is you properly document and also properly come out with a consent decision, so that someone decide, and because really. Circumstances where you need to bring together the partners, and also you decide, because you find it's really they need to make up their mind, but you give the package of information they need, and also the benefit and also the side effects that come with abortion.
Well, thank you so much, Mr. Gabriel, for having given us your insight on comprehensive abortion care today. And what do you have any last words? What are are there some things that you would love maybe our viewers out there to know, or anyone out there watching us to know?
Well, one other thing that we need to know, the goal, the main goal of abortion is to reduce mortality and morbidity that come with the complication that may come out due to complication and that will arise due to abortion. We need to really fight, and it's really life-saving, as I said earlier. Then the one other thing, we need to provide emotional support, because after someone has lost a dear one, after keeping the pregnant for some time and miscarriage could have happened, really the person needs emotional support, and that's what they always need to consider most, because really someone feel the pain and losing someone maybe expected and all that. Then lastly, one other thing we need to know also, abortion is a reproductive health care service. It is really very key that we need to make a choice, and also, and as well, the family needs to decide, because some of these other circumstances happen anywhere else.
Well, thank you so much. Just know today we are calling out for anyone out there. If you know that you've really heard in what has happened here, so we've talked about abortion being a life-saving healthcare. So we really call upon everyone out there to support to ensure that we get to reduce the rate of the maternal mortality and morbidity rates in our country at large. Otherwise, thank you so much. This has been the Big Topic Show with your host, Emanuela. Don't get off, because we still have a lot of programs coming in. You can still follow us on our social media handles, and this show has been sponsored by Anti-Khaki Toll-Free Helpline, and you can always reach out, call the Anti-Khaki Toll-Free Helpline to access any of our services, any service in regards to sexual reproductive health. Otherwise, thank you so much. It has been a good day with you.